Welcome back, everyone. Jacksonville's Lakeview Health Treatment Center is expanding with the addition of Koru Springs, a full spectrum eating disorder center. And right now they are accepting patients. Great time to talk about mental health, and it is Mental Health Awareness Month. And eating disorders are serious mental health conditions. Look at this number. According to the CDC, it is estimated about 30 million people in the U.S. suffer from some type of eating disorder, and many of them can make a full recovery. You got to talk about it. You have to be aware about it, and in some cases, you do need treatment and support. Joining me now to talk more about the expansion, Heidi Graber is here with us today to talk about how eating disorders can develop and how we can really help people. You know, we were just talking, and I think the interesting part is that this starts sometimes as young as 12 years old. How do you know that your child may be having a problem with eating disorders?
It's a good question. Some of the things that you want to look for is any mood or behavior change. It could be maybe they're fearful around food or they're hiding food. Height and growth can be affected in general. There's a lot of little things that parents can look for, but kind of their interaction with food and how do they eat? How do they, portray some of those things? So those are some of the main points to kind of watch for.
I know there's different type, bulimia, anorexia, even like choosing and only eating certain foods. Can you just explain like the degrees and when it becomes dangerous and maybe when it's more than just a conversation is needed?
Sure. So there is lots of different types of eating disorders, and that's why it's so important for interventions to happen quickly. And some of them might, bulimia is more with the purging, anorexia is more with restrictive, and then they have combinations or some that are other that just don't meet criteria quite for both of them. Or they're restricting without the body image piece. So there's a lot of different kind of working factors that go into that. So the early intervention is really key.
I think, I think about even growing up, and food, it was always such an issue in my home. It was like, you don't want to eat that, you're going to get fat, you don't want to do this. And I was a thicker child, I danced, and I always felt like I was overweight. Even to this day, I feel that way. So I wonder, is it the conversations that we need to be having in our homes just so that everybody kind of understands a healthy body image, healthy eating, and it just needs to be like this continual talk, especially with our young girls.
Yes, absolutely. And also social media plays a part too.
Oh gosh, yeah.
Monitoring some of that and doing that. But yes, having those healthy conversations at home is where it really starts.
All right, so Koru Springs, tell me about this expansion and what you're offering people who really do need that in-depth help.
Yeah, we're really excited. Lakeview Health has just been a phenomenal place for 20 years, and what we did is we took kind of the basis of that program and the success of that and just really expanded to a different population. And so we're serving adult women, and we have a 26-bed facility, and it treats all spectrums of eating disorders. And we look at nutrition, of course, plays a very big part of it, medical care, psychiatric care, therapy, of course, and then the support network too. We really look to build that piece of it.
Because I was reading and it looked like for people who may need to go into this type of facility, sometimes it's paired with something else like a substance abuse issue, or there's some other deeper things that really need some intense working through.
Yep, that is very, very common that we see, that co-occurring disorder with substance use. And so that's why our program really kind of stands out, because we can treat both. And we really do look at both of those disorders and treat them at the same time. And that is just one thing that we don't see that in a lot of places. So our treatment team is really excited to get in and start working and helping a lot of women in our community.
All right, I love it. I mean, clearly there's a need, and now there is an option. So if this is resonating with you and you just want to learn more, and maybe the facility isn't what you need, but just somebody to talk to and to work through, the website, am I saying it right? Is it Koru Spring?
Koru Spring.
Koru Spring. Okay,
yep.
KoruSpring.com. The number to call, 844-951-1888. Very easy. We'll get all this on the website as well. So thank you for coming in, and thank you for working with this population.
Absolutely.
too.
Thank you for having me.